Hi, I'm Dr. Leon Scott with Vanderbilt Orthopaedics, Division of Sports Medicine. And we're going to try something a little different today. Going to make a series of videos, if you guys like these, called Health Tips. It's going to be practical information that you can use to help treat minor issues at home on your own. And how to know when it's time to come in and see one of us. All right, let's check this out. Okay, we're going to talk about wrist braces. Okay, we've all been there. You accidentally trip on your feet, you fall onto something, you try and play it off, but you hurt your wrist. And you're at the convenience store trying to figure out what the braces are. So we're going to go over 4 major types of braces, what their uses are, and then talk about what to look for if you need to come in and see us. This first one is the standard simple wrist brace. Sometimes it comes as like a neoprene wrap, but the key to it is that it has one firm plate that goes on the palm side of the wrist. So once you have it on, it's pretty simple. It's really just a compression wrap for just a little bit of mild comfort and support. The main structural support comes from a plate that's on the palm side of the wrist. From a medical standpoint, the main thing this is really going to do is just stop your wrist from flexing forward, which may be helpful if you have carpal tunnel, but other than a little bit of compression and comfort, it's not going to do too much for a significant wrist sprain. This next one is the classic wrist brace tool. So the key to this one is that it has support on both sides of the wrist brace. And when placed on, it protects against bringing the wrist back and forward. So if you have a wrist sprain, this is an ideal tool to keep it stable while things heal. Here's a little secret. If you have that pain in your wrist kind of in the midline, that's when these types of braces work perfectly. But if you have pain that's a little bit more on the thumb side and things are a little bit stiff or painful, then you may want to consider supporting your wrist with something a little different. This is called a thumb spica. Sometimes people will use these braces if they have a little bit of arthritis in their thumb or if they have some tendonitis in their thumb. But as far as wrist injuries are concerned, their sweet spot is if you're having pain in the wrist that also includes pain on the thumb side. The last brace is called a wrist widget. What is this one for? Have you ever moved your wrist around and felt it clicking and popping out on the pinky side? Or maybe you fell on your wrist once and had some pain that's just above that bump. If that pain has been there chronically, then a wrist widget can be helpful. These straps help put pressure over a structure just around that bump on the pinky side of your wrist, and also can help support those tendons, keeping them in place. So if you're playing tennis, it's not clicking, popping out of place. But when should you come in to see us? Well, if there's a deformity, if there's any numbness in the fingers, come and see us immediately. And if you try these tools, but you find that the pain isn't improving on that 3rd day, then it's time to come in and see us. Hey, we got everything you need here. We have x-ray, casting, and you know we got the right braces. Hopefully you found that helpful. And if you did, please share it with people that you know. Remember to follow @OrthoVUMC on Twitter and come see us at one of the sports medicine offices around the Nashville area. Thanks.